A recent poll reveals about a third of Americans won't get the COVID-19 vaccine or are undecided about getting it. The poll was conducted by the Associated Press and the NORC Center for Public Affairs Research. It found that while 67% of Americans plan to or had already been vaccinated, 15% say they certainly won't, and 17% say they're leaning toward not getting the vaccine but haven't completely ruled it out. But a hesitancy towards vaccines is not unique to the coronavirus pandemic. It's something doctors have been trying to overcome for decades. For more, I'm joined by Thompson. Derek is a staff writer for The Atlantic and the author of the article, The Surprising Key to Combating Vaccine Refusal. Derek, welcome. Thanks very much for joining us. So you write that vaccine hesitancy is not just one thing, but a portfolio. Can you explain, Derek, how different groups view the vaccine? Because as you point out in your piece, hesitancy may not even encompass all of the concerns that the different groups have and the way that you describe what it is their approach is to the vaccine.
Yeah, when I wrote this article, I did so because as I was talking to more people about vaccine hesitancy, more people were saying that hesitancy isn't the right noun for whatever demographic they were looking at. For Republicans, for example, 50% of whom said they don't want to take this vaccine, it's not hesitancy. It's more like dissent, disinformation. Sometimes among young Republicans and young adults entirely, it's indifference. Among other populations with higher vaccine resistance or hesitancy, non-white Americans, Black, Hispanic, American Indians, sometimes hesitancy doesn't do very much to describe what they're thinking either. I talked to one UNC professor who said that among the Black Americans that she knows it's more about vaccine deliberation, a cautious wait-and-see attitude, which is very different than the vaccine disinformation that you see among some parts of the far right in particular. So you really need to disentangle this portfolio of vaccine resistance, especially if you want to combat it.
So given what you just spelled out, it is sort of this constellation of vaccine attitudes, I guess we can say safely. How critical is it then for doctors and health professionals to have a multi-pronged approach to getting people to believe in the science and have confidence in vaccines?
Well, the approach has to be multi-pronged because the problem has many prongs. You can't, for example, fix vaccine hesitation among Republicans who believe that COVID-19 is still essentially a hoax or not anything to be taken seriously by telling them about how safe the vaccine is. It doesn't matter how safe the vaccine is. They don't think COVID-19 is that serious. So you have an entirely different problem. There's other populations, especially non-white populations among the people that I spoke to, who said they really need to be talked to in a way that looks into their own motivations. There's a concept in essentially in persuasion, especially medical persuasion, known as motivational interviewing, where essentially if you're a clinician working with a large population among people who are vaccine resistant or vaccine hesitant, what you do is you figure out what are their motivations. Do they want to be healthy? Do they want to keep their family healthy? Do they want to get back to a normal life? You find that motivation and then you attach the vaccine to it rather than sort of slamming them with a bunch of statistics. Still, I think others, including you and me, people in the national media, we need to do a better job of giving people a more realistic understanding of the costs and benefits of taking and not taking this vaccine. I see, for example, sometimes people talk about the Johnson & Johnson vaccine with only 66% or so efficacy in its clinical trials as being somehow extremely deficient compared to the Moderna and Pfizer vaccines. But if you look at how it's done against the variants, you look at how it's done in terms of hospitalizations and deaths, it is a spectacularly successful vaccine. So you and I should be in a position of really, I think, proclaiming just how wondrous these vaccines are, even in comparison to past flu vaccines. It's a very different strategy across the board, and you really need to figure out who you're talking to figure out the best strategy to approach them with.
Right. Well, you're right. The presentation of the information here matters so much. I also want to ask you, though, Derek, you know, this idea of misinformation and disinformation is something we heard a lot about surrounding the election. But when it comes specifically to the COVID-19 vaccines, how big of a problem is it, not just for the COVID-19 vaccines, but for vaccines in general?
Vaccines in general, we definitely know that there's a group of Americans who, for whatever reason, they used to be across the political spectrum. Now I think they lean probably more toward the right, who are just anti-vaccines. They just don't think that vaccines are good. They think they're unnatural. They want to raise their children in a holistic, naturalistic way. I don't know. I don't entirely empathize with the position, but this is their position. And so they're anti-vax for some reason. But in terms of misinformation, I think it's important to recognize that there's really sort of three different levels of misinformation. At the top level, you have people saying just crazy stuff like Bill Gates is putting, his microchips or something in these vaccines and trying to control us with his robot armies or something. Like, this is obviously complete nonsense. But you come further down the spectrum of misinformation, and you even have sort of, major news outlets, say like NBC on February 5th, announcing that a woman in her 50s or 60s died shortly after taking a COVID vaccine. Now, it is true that she died shortly after taking a COVID vaccine. So this wasn't, misinformation. It was technically true. But her death had nothing to do with the vaccine. So exactly how effective is this as a means of conveying useful information to people? It's not effective at all. It's actually ineffective because it makes people think that vaccines that are extraordinarily safe, in fact, are extraordinarily dangerous. So I want to be clear that it's not just the disinformation mongers that we should be looking at and trying to fix, whether it's, looking at how, the way that social media treats them or something else. It's also people like you and me, people in the media. We need to think about the most responsible way to tell people about both how serious COVID-19 is and how effective these vaccines are in order to drive home the point that the cost-benefit analysis for just about everybody is, yes, take these vaccines.
It's such a good point because, context is everything. And when people are just looking at a headline, as you say, it is easy to miss some of the nuances if that information is not presented properly in context. It's something that certainly we all need to be very mindful of. We touched on this at the other question about just the different kinds of approaches that health professionals can take depending on the group that they're trying to reach. But I wonder if you can talk about this a little bit more, some of the other methods. So you talked about, for instance, this motivation, trying to get at the sense of what is it that may motivate a person to remain healthy. That has been an effective technique in certain populations. What else, Derek? What else seems to be an effective method to reach people who, for whatever reason, are not responsive to the information that's being presented now?
Yeah, I think about it in two different buckets. I think there's like a cost-benefit analysis approach, and there's this motivational interview approach. So I've already talked about motivational interviewing. That's about having a neighborly conversation with someone, figuring out what motivates them, what moves them. Why do they think that it's important to get a vaccine or not get a vaccine? What do they want out of life? Do they want to live a healthy life? Do they want to protect their family? Do they want to go back to restaurants? You latch onto that. You let them give you the motivation before you sort of, move into that element of persuasion. On the other hand, I think there's some people who aren't getting this vaccine because they're doing a cost-benefit analysis. They're saying, well, look, the cost of this vaccine is too high because I'm hearing that 50-year-olds are dying right after getting the shot. And I don't think the benefits are that high either because I just saw this headline about how the Johnson & Johnson vaccine is only 66% effective. Well, 66% effective, that's basically a coin flip. That's 50-50. So we're doing a bad job reporting both the cost side and the benefit side, I think. And this scales up to the job of national media in order to more effectively communicate both the real costs and the real benefits of getting vaccinated.
All right, Derek Thompson. Derek, we say this all the time that no group is a monolith, but your piece really kind of teases out how that is absolutely the case when it comes to those Americans among us who, for whatever reason, do not intend to take the vaccine. I hope a lot of folks read it because it does kind of break out these groups in a way that I haven't really seen before. Derek Thompson, thank you so much.
Thank you.